Welcome to the Bells I Hear podcast. We will speak with experts who will debunk the myths and misconceptions surrounding homelessness and highlight the innovative approaches for addressing the issues, causes, and consequences of housing insecurity. I'm Elisa Smith, your host, a mentor, professor of legal studies, and former public defender. Thanks for tuning in to the Bells I Hear. And today I'm delighted to host a conversation with Mina Reoutt-Swabeck and Sean Murray. Mina works at Fountain House as a mental health social practitioner for supported housing. Sean Murray is a member of Fountain House, and he serves on the New York City Continuum of Care Committee, which works with HUD to allocate federal money to help house the homeless. Today, we will focus on our conversation on the uniqueness of Fountain House, which was established in 1948, and the clubhouse model and its philosophy of community as therapy. Hello, and thank you for joining us today, Mina and Sean. Before we dive into our topic for the day, could you tell the audience a little bit about yourself? Mina, what brought you to Fountain House? What brought you to a career as a social practitioner for supportive housing?
Yeah, so I found Fountain House through, I think the now conventional way of finding work, which was Indeed. But Fountain House was definitely a lot more than just a work opportunity I found online. I was, and I still am, very deeply drawn to the idea of using community in a way to promote mental health recovery and help people reintegrate back into their communities. So I think my work history had a lot to do with leading me to Fountain House. I've worked in these more conventional settings for mental health and housing before I started as a social practitioner within supported housing. So I'm from California, and I worked for about a year at a hospital there, and I definitely learned a lot in that setting, and especially about my desire to work within mental health. I still kind of found myself a bit concerned with the approaches to recovery within just a general hospital setting, largely due to the high amount of people who would discharge, be out for a month, and then they get readmitted into another psychiatric hospital all over again. I'm not trying to say here that I think recovery is linear or that the methods that were used at that hospital were ineffective. However, there just seemed to be a lack of intervention or resources after their discharge that if applied, if implemented, would have likely reduced the rates of readmittance into a psychiatric hospital again. I also did work as a case manager at a home-based program where the goal there was to prevent eviction through offering rental subsidies. I just found this work to be dispassionate for my liking. Caseload sizes could exceed 100 people. The work is done over the phone. You're not connecting with people face-to-face. The work is largely just paper pushing. You're collecting documents from landlords and from tenants, and you're submitting that back to the Human Resources Administration in New York City. I also just had some issues with kind of the eligibility criteria and kind of being a face to enforce that. Just to give you an example, at the time I was working there, I'm not sure if this is the same, but you had to have resided in a public shelter and not a private shelter to receive the rental assistance. And there was someone who I had to deny for that reason. And that's not fun. It's a very hard conversation to have, to tell someone that because they were in the wrong shelter, they cannot receive assistance that's very direly needed.
So let me ask, what is supportive housing exactly? Like you've done a little bit of comparing and contrasting with the differences, but if you can highlight more directly what supporting housing is, how it differs from sheltered living, and what exactly Fountain House is.
Yeah, so I think I'll let Sean address the supported housing question, and then I can come in and talk more about Fountain House.
Okay, so supportive housing is permanent, whereas shelters are not permanent. So that's the first difference. And supportive housing comes with services. Sometimes those services are optional, sometimes they're not. And the range of services can vary quite widely, but that is basically the difference between the two models.
And have you had experiences with both?
No, I was never shelter homeless. I went right to supportive housing after being in the hospital for quite some time.
Are you aware of people that have been in sheltered living?
Oh, I know tons of people who've been in shelters from Fountain House.
And what are the difficulties that they face that are better addressed with supportive housing?
Well, in a shelter, you have no privacy. They can be very unsafe. You can't, I mean, some of them, you have nowhere to store your stuff. You have to leave the shelter during the day and people have nowhere to go. And supportive housing, like I have an apartment. I live alone in my apartment in a regular building. This is called scattered site. You know, Mina comes and sees me once every 3 months in the apartment. I see Mina in the clubhouse and I get some support from Fountain House. I don't need a lot, but that is the main difference. It's hugely different. So the housing first model of supportive housing, the philosophy is to skip the shelter and put people immediately into supportive housing and really and wrap them around with services. So when you hear people, politicians and supportive housing people talk about wraparound services, this is what they mean. Is that the services come to them. They tend to be more intensive when someone first enters supportive housing, and then they become less intensive. The housing first model actually calls for weekly visits with your caseworker, which are mandatory. Then the other, services such as mental health treatment and addiction treatment and budgeting and whatever are optional. And counterintuitively, not requiring services for most people is as effective as requiring services such as mental health services and addiction treatment. Anyway.
The mandated component is problematic. And you've been a member of Fountain House since 2013.
Since 2013, yes.
So Mina, can you tell us a little bit about what Fountain House is and the services that Sean is getting in Fountain House?
Yeah, so Fountain House, just more broadly, if we're taking it a little, separated from housing, just to begin with, Fountain House is working to build community through connecting members to each other through work that's meaningful and offering opportunities to support one another. The role of the social practitioner is to facilitate this work, and this process is called social practice. And the methods that are applied, that's social practice. So, for example, me and Sean are in a resource area, or what we at the clubhouse would refer to as a unit, that's supporting members with their educational and employment goals. The social practitioners and I, to an extent, will help to create these projects that are engaging members, again, in work that's meaningful and that's bridging other members to their goals. I think the best example that I can kind of offer you is maybe the academic scholarship. Within this setting, the academic scholarship isn't only just an opportunity for members to receive some financial assistance to support their academic goals. It's also a place where the interviewing of the candidate, the decision-making process of whether the candidate gets the scholarship or not, and the process of making sure that the scholarship is received by the members is done by members. So Fountain House is using community as a therapeutic tool here by giving the opportunity for people to advocate for themselves and others, an opportunity for people to make their own decisions, and ultimately to guide their own care through the clubhouse. And this is really profoundly important for someone who may have historically been unable to do these things as a result of isolation or as a result of chronic hospitalization. The overarching goal here is just to give members, the confidence to use these practices that are developed inside of the clubhouse, outside in their broader communities, in their work, in other volunteer spaces in their neighborhoods.
Is that how you would define success?
Success in supported housing might look a little different in that context, but I think, yes, that's the ultimate goal of Fountain House. I will say people are different, right? And they navigate, success is measured differently for different people, for sure. And I think that's important to consider. There are some people who might utilize the clubhouse more than others, and they might end up using it for longer periods of time. So...
And they really do meet you where you are. So I received an academic scholarship in the spring for op-ed writing because one of my employment goals is actually to start working as a freelance journalist writing about homelessness and mental illness. And so one of the things that Mina has helped me with was editing one of my op-eds. And so they're really meeting members where they are. There's a whole transitional employment program that has jobs that are very different than working as a freelance journalist, but we're all very different and have different goals and needs. And Fountain House does a pretty good job of meeting people where they need to be.
So it sounds like an individualized experience. So if I had other members come and talk with us, they would have different experiences and different
Yep.
positive outcomes with regard to how their needs are being met.
Absolutely, especially because, like I referred to, there's different resource areas within the clubhouse or units. And I think that's a method that people can use to guide their own care. You can choose what unit is important for you to help other members in achieving those goals. And then you can also use those units to achieve your own goal, whether that's through wellness or through promoting, through going through school again or getting work again.
And what are those other units? I know education is a unit. What are the other units that are available to members at Fountain House?
So there's Home and Garden, which runs the farm. There's a farm in New Jersey that you can go to, which I've spent a huge amount of time at. When I first joined Fountain House, I was not super well, and I spent a lot of time at the farm. There's a wellness unit, which does healthy snacks for the whole house, and there's a gym. There's a full-service gym up there, so they monitor the gym and wash the clothes because you can actually come in and you don't need any clothes or sneakers or gym equipment to use the gym. There's a communications unit, which publishes a newspaper, and
then research.
Yeah.
Research is they're facilitating kind of different studies throughout the clubhouse. And they also have kind of a digital aspect to them as well, where they're doing a lot of recording.
And they're starting to work with outside researchers pretty intensively. And one of the things that I'm going to be doing through employment is working with a social enterprise that is members doing research. And I have some background in that, so I'm quite interested in doing this.
Right, because you were actually in a PhD program.
I was.
And so what kind of research do you think that you'll be involved in?
Well, one of the things I'm working on right now is a big, a 4,000 to 5,000 word piece on homelessness and stigma. So I've done a lot of research on stigma. I do research myself. I've talked to a lot of the leading academics on this. I had coffee with someone who's written pretty extensively about insight and forced treatment on Friday. I've worked very closely with one of the most prominent Housing First scholars, and I bring some of that back to Fountain House with the advocacy group that I do, because Fountain House is now doing quite a bit of advocacy. And so I've been pushing really hard to make housing a central part of Fountain House's work. Because if you don't have housing, how can you recover from your mental illness?
Right. Housing is foundational.
Yeah.
So before we move to the advocacy piece, one of the things that I thought was interesting when I was doing my research about Fountain House is that it says that members can stay indefinitely. One, do they? And two, how do you support individuals almost on a permanent basis?
Yeah, so one of the primary standards is that membership is voluntary and it's without any time limit. Sean can, I think, speak to that experience a little bit, and then it can bounce back to me again because I have a lot more to add with that.
So I was pretty active in Fountain House for the first 5 years after I got out of the hospital. So until 2017, 18. And then honestly, I started working, I got bored. I didn't feel like there was meaningful work for me to do in the clubhouse. And I kind of just drifted away. And that was my prerogative. That was my choice. And Fountain House is, knows that happens. About almost a year ago, I had been talking to people. I'm actually close friends who's been a longtime member of Fountain House, who got me into Fountain House. I met her in the hospital when we were doing ACT together. Anyway, I was talking to Jasmine, and she was just the clubhouse has really changed. There's a lot of different kind of work happening there, and you might be more interested in what's going on. And I came back and immediately was just oh, this is fantastic. It's a place for me to go. I come here, I do my writing, I do my work. People help me in various ways, and it's been great.
Wonderful, wonderful. What do you have to add, Mina?
Yeah, so I just want to say, within the context of supported housing as well, so long as the conditions of the lease and the program's policy and procedure are being met, members are really allowed to stay in their apartments for as long as they please. Fountain House is also really exceptionally good, I believe, at working with members to ensure that they can stay in their apartments, even if there are these momentary lapses in the following lease agreement. And just to add a little bit more of an example here, I think one of the most clear challenges that can arise is just not paying rent or falling into rent arrears. And even in this case, any good supported housing program is going to use eviction as the last possible intervention here. And within Fountain House, there's a lot that can be done to prevent eviction in the case of rent arrears. We make sure that we can have rent pulled automatically from people's bank accounts. We can apply for government assistance programs through the one-shot deal. We can connect members to financial advisors or to a representative payee, which is essentially just a person who comes in externally to help with budgeting. We can also put people on payment plans as well, so that way members can pay back their arrears at an incredibly reasonable rate for their income. So that's just an example of how we're working with people to stay within supported housing in their apartments for as long as they please. But I also think it's really important to note that because tenants are allowed to stay indefinitely, New York City does have a growing population of seniors living in supported housing programs and supported housing apartments. So this is going to be a bit of a rising challenge in how we're helping people with changing physical needs stay in their apartments and maintain their independence for as long as possible. And Fountain House is able to address these concerns. It's not like it's something that is in a vacuum. There is opportunities for people to move into assisted living facilities, but it's important to note, too, in New York City, that moving into an assisted living facility can be a challenge. If they don't offer psychiatric services, they could actually deny someone with a serious mental illness just on the basis that they do not provide all services that would support that person. And it sounds like it's discrimination, but it's completely legal. Another thing is that Fountain House does have some housing options for senior members, and it's really close to the clubhouse, which is an amazing opportunity. However, the capacity is just limited, especially in comparison to the amount of people who currently need it and who will need that support down the line. But it's not like Fountain House isn't aware of this. We were deciding fiscal priorities back in July, and this was kind of the senior housing was considered, as something that would be, financially prioritized within the next year. So I'm hopeful that we're going to see some more discussions and there's more awareness about this at the very least.
So it sounds like at Fountain House, there's this ongoing conversation about solutions to the growing housing instability in New York City, insecurity, homelessness, and those kinds of things. And I think that leads us to some of the barriers. And I think Mina mentioned a barrier that certain individuals are precluded from housing because of serious mental illness. And I know that, Sean, you've done a lot of advocacy in the area of, these spaces. Can you tell us a little bit about some of the barriers in finding housing, especially for individuals with serious mental illness?
Well, sure. I mean, I can talk specifically about supportive housing in some depth because New York City has, I believe, the only law that requires reporting of all of the applications and rejections for supportive housing on an annual basis. And the housing providers are required to list the reasons why they reject people. The most common reason is that the person is too disabled to be housed. And we know that the entire shelter system, the entire supportive housing system, the entire homelessness system is not accessible to people with disabilities. The law is not enforced. There is zero priority in communities around the country to making the system accessible. New York City is, in addition to having a right to shelter law where, the city is obligated to house every person who doesn't have a home. There was a lawsuit in 2015 called Butler versus City of New York that was a whole bunch of disabled people who sued the city and said, we don't have access to the shelters. And now Coalition for the Homeless estimates that 65% of single adults who are homeless have a serious disability that needs accommodation. About 45% of families who are in the shelter system have a member of their family who has a serious disability that requires accommodation.
It sounds like there's some conflicting laws, right? From what you're saying, it sounds like there's laws that say individuals should be able to get housing, and then there's laws that preclude them from access. Am I understanding that right, or did I misunderstand?
No, there are no laws precluding them from access. It's just practice. They are allowed to do this. The housing providers, what is called as creaming, is when the supportive housing providers basically say, we want able-bodied people who are high functioning and are not going to require a lot of staff support in our units. And these are the people who end up on the street and are visibly homeless, kind of spectacularly homeless, most with substance use or mental health issues, and they become the face of homelessness. But the resources are simply not there, and because the government basically abdicates their authority to force the nonprofits that they contract with to house people, that the most vulnerable, the most disabled end up not getting housed, and they end up on the street.
And so that's a huge problem.
Oh, it's horrifying.
And
And there's
so
very little attention being paid to it by the press,
why? hmm
by
Why do you think that
politicians.
is? Why do you think that is that so few people are paying? Why are politicians and the media ignoring this situation?
Honestly, I'm not sure. I think it's because it's the most stigmatized people that even people who, think that they're sympathetic can't quite grapple. And it's an intractable, expensive problem to address.
Yeah.
Because you get people who have such complex needs that it's a cost that society does not want to bear, and they would rather not pay and allow these people to die.
If you had unlimited resources and unlimited power, both of those things, what solution do you think New York City could create to help this growing problem?
Honestly, I don't think there will be a solution until the people in supportive housing get together and file a lawsuit, which I have been told by lawyers could be done.
And then what
The
would
state
it?
legislature did passed a law a few years ago requiring an audit, requiring the Office of Mental Health to perform an audit of the entire mental health homelessness system for disability access. And Governor Hochul vetoed that bill because it was going to cost money. And so if we don't know, they don't want to know how deep the problem is. I mean, I confronted Moira Tashian, who is the number 2 person in OMH, or she is no longer there, but I confronted her in a public forum about the scattered site appropriation that Governor Hochul made for 750 new units in the state. And I asked her if any of those units were going to be ADA accessible, and she said no, not one. And I said, well, can you make more of the congregate units accessible? Because as it is right now in the congregate buildings that they make, they only follow the minimum requirements of the ADA, which is 5% mobility impairment, 2% hearing, and 2% vision. And we know from studies that the number of people who are chronically homeless, which is homeless for a year and a serious disability, many, many people have multiple disabilities. And so they won't even do more in the congregate buildings, whereas the estimates are like 20-25% would actually accommodate the need, but they don't want to spend the money,
Right.
even when they're appropriating it for supportive housing.
So let's stay along these same lines, but let's talk a little bit about your advocacy, because you've been an advocate for a while. Tell us about that advocacy, what drew you to advocacy, and maybe even share a win, something that you advocated for that you're most proud of.
Okay. When I drifted away from Fountain House, I wanted some meaningful work to do. And so I started contacting organizations to volunteer. And I contacted Coalition for the Homeless. And I was like, look, I don't want to distribute food in Grand Central, which is one of their main volunteer jobs. I can't work that much, but I can do some meaningful work. And they said, well, we can't accommodate you, but you should go work for Shout. So that's how I found Shout.
And tell us about Shout. Tell us what Shout is.
Shout is a group of people who live in supportive housing. It's for people who live in supportive housing and or are applying for supportive housing in New York City, but now we're working pretty extensively at the state level for various reasons that have to do with the Office of Mental Health. But we do a lot of legislation. We passed the bill that I was talking about before that requires the reporting on supportive housing admissions. We passed a tenants' bill of rights in New York City, which is basically just like forcing the housing providers to tell the tenants what their rights as tenants are in the state of New York. So Fountain House, when I joined Fountain House Housing, they gave me the tenants' bill of rights. But this was an OMH-funded program. The state funds most of the supportive housing in New York City.
Before you go on, what's OMH?
The Office of Mental Health.
Thank you.
So this OMH funds most of the supportive housing. And when we passed the Tenants' Bill of Rights, they said, well, we're not going to make our fundees follow that law. Even though in New York City, tenants' rights are part of the human rights law. And I have tried to pin them down over and over again and, saying, okay, so what you're denying people access to is a fundamental human right. And they say, yes, because we are sovereign, because we are the state, and you're trying to enforce city laws on the state. And so now Shout is passing or putting on the floor. The tenants' rights law is on the floor of the assembly right now. We're looking for a Senate sponsor. And we have a whole suite of bills to regulate the supportive housing industry because OMH has abdicated its authority to regulate the nonprofits that it funds. So there's something called the Supportive Housing Guidelines, which is the rules for both tenants and housing providers. And everything in the guideline is a suggestion. So there's no way of enforcing it. So like when my housing provider before I was with Fountain House, they decided they wanted to be rid of me because I was too much of a pain in the butt. And the housing provider stopped paying my rent to my landlord repeatedly. And so after 3 months, I would get evicted. And I went to OMH and said, can you please make them pay the rent? Like that's the one thing they have to do. And OMH said, no, we can't make them do that. You have to go to court yourself. And I got a lawyer multiple times, and eventually I found out from Shout that I could access my own records, and I forced an audit of my housing provider, and they shut the program down. OMH did, but that's because of Shout.
So if you're successful in getting this legislation passed, will it solve that particular barrier to access to housing or continued housing?
One of the bills would actually really address the rejections of and access to supportive housing. But the biggest issue with access is there's simply not enough supportive housing. So in New York City, 80% of the people that are approved for supportive housing by the city don't get housed. They end up back in shelters and on the street because there's simply not the housing stock to accommodate the people who have who the state has decided qualify for supportive housing.
Do you have an estimate of what that need looks like, either Sean or Mina, in terms of how many additional supportive housing units would be required to fully house?
A lot more than there is.
A lot
would be
more.
thousands a year, and they're trumpeting a few, like Cuomo just proposed in his homelessness platform, which I read in the Times. He's proposing 600 new units a year if he's elected mayor. And we're talking a few thousand people who are rejected every year. There are other ways that people could be housed. There are other ways that they could free up supportive housing units by allowing people who are stable to go into a voucher like CityFEPS or the Housing Access Voucher Program, the new state program. There is a program for Section 8.
Can you tell the audience just briefly, like what those things are? Like what is a voucher program and what are some of these alternatives?
Yeah, so a voucher program is like Section 8 or the Housing Choice Voucher, which is what it's called now, which is the federally funded voucher program. And basically what it is for low-income people, And the deal is you have to have an apartment that's under a certain level of rent, and you pay 30 to 40% of your income in rent. And the government picks up the rest of that bill. So in New York State, in New York City, we have city FEPs, which is the city version.
That he was referring to city FAPs is what I was working when I was doing it as a case manager at a home-based program.
And there's a new statewide voucher, which is, which would be huge if it was actually funded. But the governor, I think, funded a few tens of millions of dollars for it. It's like a pilot program at this point, and the need is huge. But so for me, I'm in supportive housing. I've been stable for quite some time. I have not been hospitalized since 2013. I have not been evicted because I'm able to pay my rent. And I could be moved to a city theft voucher, but the city disallows me from doing that because I'm permanently housed.
I see.
The only way I could access a city theft voucher is to go into a shelter, to give up my apartment, go into a shelter for 3 to 6 months, and then I could have access to a city theft voucher. Okay. The state has also disallowed people in supportive housing. We're working with the state legislature to try to open that up to us for this exact reason, to allow people. But it's one way that they could open up huge numbers of units without spending $500,000 on every new supportive housing unit in a congregate building.
Right. That sounds like a great solution to this problem, or at least a partial solution. It probably isn't the whole solution. We're probably going to wrap up soon. Is there anything I have not touched on in this conversation that you think is important to the audience to know about Fountain House, supportive housing, barriers, solutions, anything that we haven't touched upon?
And I can also, we kind of touched on what success looks like, but I can expand more upon that there if you have any questions. So just to begin, I think, again, just to add to the reason why I started working in Fountain House was that I just found like using community as a tool to foster recovery just to make a lot of sense to me. It feels very intuitive. I think regardless of whether or not someone has experienced a serious mental illness, we can all relate to what it feels like to be isolated, to lack a sense of purpose, to lack a sense of belonging, or to lack drive. And we know how that negatively impacts us. I think we can all draw upon our experiences from the pandemic or maybe through bouts of unemployment. But you have to imagine that these negative impacts are only going to be amplified when someone has an illness that's been deeply stigmatized, or someone who has been institutionalized for vast periods of their life. Community is the antithesis to isolation, so it makes a lot of sense to me that community is thus the tool for mental health recovery. And then just to get into the difference between Fountain House's supported model, just to get to the difference of the supported housing model that's offered by Fountain House versus other supported housing program, is that we're trying to integrate the clubhouse model within our housing. And we're doing this through several ways. And I do think this is something that's a work in progress because we're trying to build independence without creating isolation, which, as you can imagine, is a bit of a hard line to tread. So we do this in kind of 3 ways, and you can pause me if you have any questions. But we do this through location, through actually facilitating the move into the supported housing program, and then through maintaining a connection into Fountain House after someone comes in. So just to give you a bit of context, especially about location, Fountain House's supported housing program is a scattered site program, and this means that members live in buildings throughout the 5 boroughs, and these buildings have tenants that are not necessarily a part of Fountain House's supported housing programs. These are tenants who are paying market rate on their rent or the master leasers of their apartment. So when an apartment is being found, the goal here is to start by creating these kind of pocket communities by having members close to each other in their neighborhoods or even within the same building. We also want to ensure that members have a choice in where they're living. They can tour apartments and they get to decide for themselves if it's going to be a good fit or not. And this is creating, again, a small community where if someone needs a cup of sugar, right, they have someone they can rely on if needed. I do want to add, I am in direct support services, so I'm not doing this kind of work, but our leasing operations specialist, Emily Fisher, is, and she does a really extraordinary job of finding buildings with these good locations and with really effective property management companies, which down the line makes my job a lot easier if I'm not having to fight supers to do their job.
A lot of supportive housing nonprofits right now are refusing to take on any new scattered site projects. They're literally like Hochul appropriated that 750 scattered site units, and most of them remain unfilled because the nonprofit housing providers simply refuse to bid on the contracts because they don't want to, make people like Mina go around all the different apartments, and they want to be landlords because they make money
And
on the congregate developments.
yeah, this is just so unfortunate to hear too, just because, the scatter site program is important because people are just returning, again, they're returning to the broader community. They're, within an environment that isn't necessarily fully about mental health and mental health recovery. It's also just about being one with your neighborhood and your community.
And it sounds like there's some success in this model. There's a probable, I don't know if there's statistics or studies that have been done, but it sounds like this club model and this community-based therapy model probably is fairly successful in terms of people not, having, returning to the street or returning to other issues that they may have. So you would think that that could be something that the legislature or the council, local council could support.
Yes, although there hasn't been studies on what Fountain House is doing. There has been studies on the scattered site model. Like Housing First was originally conceived as scattered site. They were against congregate developments. They wanted people integrated into the community and invisible, not in a stigmatized location like a supportive housing development is. So there's a lot of research supporting scattered site housing, although in certain communities, congregate seems to be less stigmatizing than scattered site, although usually it's the other way around. But yeah, there's hopefully going to be studies of Fountain House's model because Fountain House is such a big clubhouse. It has a lot of housing, but most clubhouses do not have much housing.
Because, if supportive housing is a New York City thing, it can be pretty expansive. But in Pennsylvania, these clubhouses had, at most maybe 2 apartments to house their members.
And in different countries, it might be a completely different system. Like I was talking to some clubhouse directors in Finland because Finland has received a huge amount of press about solving homelessness. But it's basically like they have a really strong social housing program. And I talked to the clubhouse managers or leaders, and they were like, well, the government takes care of all the housing. Like we sort of facilitate it a little bit, but it's not like Fountain House that has this, that feels like because of the inequity that we have in the United States around housing, Fountain House needs to have the housing program. But in some other countries, like particularly in Scandinavia, they don't need to have that because housing is considered a human right, basically.
Right. So there's other support systems. If there are people out there who are listening who say, this is really something I want to become involved in, I want to help, I want to champion change or actually help people who need it, what can people do? Where can they go to help or champion?
I would say they can get involved politically. So they can get involved politically at the local level in their zoning boards, in their community boards, and embrace having supportive housing in their communities and not block it. Because this happens in New York City too. That you have community boards that are just going to say, no, we don't want homeless people. We don't want any kind of shelters in our communities. We don't want any supportive housing, but we're not really prejudiced because really the solution is for them to have housing. So it's get involved politically there and get involved politically at a larger, the larger level with the city council, with the legislature, advocate for more funding because that is hugely necessary, and advocate for accountability for the nonprofits that we fund to do this. Because like a lot of countries, these programs are all run by the state and they're accountable to the state. But here, everything is devolved to these independent nonprofits. who really have carte blanche to do whatever they want to the people they are supposed to be helping. And so building in accountability into the system is vitally important, and funding it really, and really advocating for universal social housing, housing as a human right. I think that the problem is not going to be solved until we get there.
Housing is a fundamental right. Mina?
Obviously I second that. I think maybe the only thing I can add, especially because my work is so directly involved in this field, I guess the way that I consider myself as being a helper in this situation is through my work. But one thing I think that's really important that goes along maybe a little bit before like the political involvement would be just spreading awareness about, supported housing models, spreading awareness about, even scattered site versus like congregate care buildings. I think a lot of people will have what we call like NIMBYism, which means not in my backyard. So there's people who support the idea of supported housing and they're gung-ho about it, but they don't want it to happen in their neighborhoods. But in reality, when we build residences for supported housing, for people to live in a supported housing building, we're actually increasing the property value of these places. And the reason is because these buildings are getting remodeled, they're getting refurbished, empty lots are turning into modern building. And then there's also an increase in security because these buildings are usually 24/7 staff. So, and obviously it's very ethically compelling. But unfortunately, we live in a world where I think, the finances do matter and people do need to have an understanding of that in order for things to change.
Great. Well, thank you. This has been delightful. And I know that there's so much more to talk about, but we'll just have to have you come back. I really appreciate your time. Thank you for joining us and helping bring awareness to these very important issues.
Thank you for having us.
Thank you for tuning into the Bells I Hear podcast. If you enjoyed today's episode, please subscribe to the Bells I Hear and follow us on social media. We post all of our conversations on YouTube, Spotify, and Apple. You can connect with us on Instagram and post comments or questions that we can address on upcoming shows. More information can also be found on Blogger and Substack. So many ways to learn about the issues surrounding housing insecurity. Please join us and contribute to the conversation.